Do you know the key difference between removing a central line on an intubated patient versus a non-intubated patient? Let's talk about it. Typically, when we're removing a central line in someone that is not intubated, we request that they hold their breath or bear down or hum. And that is so the intrathoracic pressure is increased so that the pressure on the inside is greater than the pressure on the outside, thus reducing the chance of the patient getting an air embolism, aka air going into the patient's bloodstream. However, on an intubated patient, we actually have to do the opposite. And in order to understand this concept, you have to understand what is going on when a patient is intubated with their intrathoracic pressures. On a non-intubated patient, when you take a deep breath in, your intrathoracic pressures are more negative. That makes sense, right? When we take a deep breath in, we're sucking air in. We are using that negative pressure in order to get that air into our lungs. And then when we take a deep breath out, the intrathoracic pressure changes to being more positive because we're pushing that air out of our lungs. But on someone that is intubated, it is the opposite. When someone is on a ventilator, in order to get the air into the patient's lungs, they actually have to push the air into the patient's lungs from the ventilator. And then the opposite, when they are taking a breath out, the ventilator is sucking the air out, aka the intrathoracic pressure is more negative. So on an intubated patient, you're actually going to want to pull that central line out at the end of inspiration because the intrathoracic pressure is more positive on inspiration in an intubated patient. So just to recap, on a non-intubated patient, you're going to have them hold their breath, you're going to have them hum, they can bear down, or you can even, if they can't follow any directions, remove that central line when they are blowing their air out. And on an intubated patient, you're going to want to do the opposite. You're going to want to pull that central line out during inspiration. This is all to reduce the chance of an air embolism entering into the patient's bloodstream and causing a very, very negative consequence.